Good afternoon. So I'm Jarad DeFife. I'm a psychologist at Emory's psychiatry department. Did I say psychologist? Let me stop, rewind. Let me check that. So I'm a psychologist at Emory's School of Medicine. And you might ask, well, why would a psychologist be here? I know nothing about medicine. Although sometimes people seem to think I do, I don't. Much to my grandmother's chagrin, who says, well, why can't we have anyone in our family become a real doctor? But much to my pleasure, I didn't. I considered it at one point, and I'm glad I didn't. And here's why. Because under all of this is the people, is you guys. And my role within the department is to work with people with chronic health conditions or complex medical conditions and really connect with how do they get back into their life? How do you cope? How do you recover? How do you sort of develop a quality of life like we were talking about that you can connect with? We know that things like depression, anxiety, are biological conditions which may have a lot of biological contributants. And in Cushing's, this is certainly the case. You can see the high degree of depression, reduced quality of life, all of those things which have biological contributants and are biological disorder. Where I come in is how do we work to knowing that, right? And in medical sort of get in, get out, see your doctor, get shoved around. It takes years to get a diagnosis. How do you start to cope with that and start to put your life together so that you can really connect to a life worth living, and not just coping with being a patient, but really go through a process with a life worth living. So in my work, I'm not a Cushing's expert. I only started kind of getting into this area about, 6 months ago now. When I talked with Adriana. And so I'm learning as I go along sort of what's involved with that. My current work is with the Emory Transplant Center, so I work with people going through organ transplantation. And there is certainly a lot of recovery, getting back to normal. There's ways in which those medications affect people's mood, anxiety, irritability, and major surgery. I also work in the Women's Mental Health Program, people with peripartum depression, role transitions around parenting, but also around women's health issues and quality of life. So thank you for the setup for that. I don't have to go through all the, this is what quality of life is, this is how we measure it. So you guys have talked about all that. What I would like to do today is talk a bit about how to really sort of cope with those issues and connect to a life that's worth living. And I'm going to start with a little bit of a story. So if you can imagine yourself out on a boat in the ocean, right? And these are comfortable, safe waters. This is a place that you are familiar with. This is a place that you've been before. It makes you feel good. You're surrounded by people that care about you and you love, and the sun is shining on you. Maybe you're having a pina colada on the deck. Maybe you're having 2 pina coladas on the deck. The fact of the matter is that life, as it is right now, looks pretty good, and things are going along as you expected. Then you start to hear a little bit of a rumble in the distance. You might want to, it was probably nothing, or it's probably something off in the way. No bother to me. Then the clouds start to move in. Sky starts to get a little darker. You look around. Something isn't quite right here. This doesn't feel good. There's that feeling in the air. Then the clouds, the rumbling starts catching up on you. You turn on the weather station on your radio and you think, all right, is there a storm coming? And the weatherman says, everything's fine, nothing to worry about here. This is going around from doctor to doctor who says, you're okay, just lose weight, or take care of yourself, or get out of my office, or take this blood pressure medication, or take this Prozac, or take this whatever. Everything's fine. And you say, okay, so you go back to deck, drinking your pina colada, thinking, all right, life's still looking okay, but this doesn't quite feel right. And then the storm builds, and you're getting tossed about, and you're sort of tossed about in the storm, and the emotions are wrapped up, and something is really wrong, and this is where it starts to get scary. And even as the storm passes, even if the illness is treated, you are now plopped all of a sudden in a place that you don't know and have never been before. This is unfamiliar territory. You look around, you don't know where you're at, it's scary. How did I get here? How many of you at some point in your life have said to yourself, this is not where I expected to be? Okay. How did I get here? This is not where I wanted to be. Things are different now. The landscape has changed. There has been, this is what author Russ Harris, who's a psychiatrist in New Zealand who works in something called acceptance and commitment therapy, calls the reality slap. This is what happened when life storms hit. When it comes to major medical conditions, sometimes that storm is a sudden one. Sometimes it comes on you very unaware. Though with Cushing's is the sense that it's a sort of more prolonged process, that this has built up over time and people really haven't paid attention to it, and that can be very frustrating. You've gone from doctor to doctor. But all of a sudden you're in this place you don't expect to be. And so how do we gather ourselves? Where do we go from here? What do I do with this new transition? And so over the course of this talk, I'd like to talk about a number of things from the psychology literature about, what to do when these sort of stressful conditions hit, what to happen when these life storms hit. How do you adjust to this new change and where you're at now? What are the things that you can do? This wasn't your fault that you got here. There's a medical condition going on. This wasn't your fault. You can't control the weather, but you are here now. So it's not your fault, but it is your responsibility to make the best of your life, because if you're not, who else is going to do it for you? And I'm sure many of you have felt the frustration of not being heard, not being seen, not being understood through all of this. So what are the things that you can think about sort of putting your life back together? All right, so the first thing is opening up, and opening up to experiences. And what do people normally do under threat, right? And if you have a lot of cortisol going in your system, you're feeling like there's a lot of threat in your environment. A lot of times people under threat start to either it's that fight or flight mode. You really want to attack something head on and you're going wild and crazy. But a lot of times people will get small, right? You want to sort of go in the white bear in the cave. As one of my lung transplant patients. It's like he's this bear in a cave. He doesn't want to look at it. He just wants to go hide away and do his thing and not connect with anyone. So the first thing that matters is to open up, to move towards your experiences, move towards your emotions, especially even if they're painful. And there are a lot of painful experiences that come with this. There's depression, there's sadness, there's anger, right? How many of you going through this process or in dealing with doctors have just felt frustrated with the process and that feeling like not being listened to, right? Go ahead. I'm sure there. And if you haven't been frustrated by going to your doctor, you've probably never been to a doctor. So it's frustrating. And so you want to sort of get in touch with that experience. But from their perspective, they've got to see a lot of people. They may want to be sensitive and responsive to your experience, but they may not have the time to do it. That's sort of the nature of our healthcare services. That's when they send them to people like me. Well, we just told this patient she's going to die in a couple months. Why don't you go see Jarad? They have a saying on the transplant team, send them to Jarad. So luckily, one of the benefits of my job is that there's allowed that kind of space and time to sit with people and go through these experiences. But one thing that you can do on your own is something called expressive writing. This has been something that somebody has thoroughly, James Pennybaker is a researcher at University of Texas who's really looked at something called an expressive writing paradigm for things like trauma, stress, medical illness, people with HIV diagnoses, this sort of thing. And find that it has really great emotional and even health benefits. That just doing this task can reduce stress, can make you feel more connected, can give you a greater sort of sense of well-being. It's not the be-all and end-all of everything, but it has been shown to be medically effective. And here is the condition, or the thing that they described to do in their studies. And this is over the next 4 days, write about your deepest emotions and thoughts about the emotional upheaval that has been influencing your life the most. In your writing, really let go and explore the event and how it's affected you. You might tie this experience to your childhood. You might tie it to your relationship with your parents, people you have loved or love now, or even your career. And the researchers told people to write continuously for about 20 minutes about whatever thoughts, feelings, and really get in touch with the emotional side of it. This is sort of similar to journaling. It's not quite the same thing. They've done it in a very targeted way. They say over the next 4 days, find a place or a time or a place where you won't be disturbed. Sit down, write continuously for about 20 minutes each day. Don't worry about censoring yourself or editing or spelling or grammar. Write only for yourself. This isn't to be shared with anyone. This is private. This is for you. You may decide at some point you may want to share this, but this is for you. This is what you're doing to take care of yourself. And the important part is to write about something that's extremely personal and important for you, and deal only with events or situations you can handle now. That last is for people who've been through severe post-traumatic stress experiences. They worried a little bit in this paradigm that people might start to re-experience or have flashbacks, and they wanted to kind of put something in there that might be a little bit of a buffer if it's something that feels traumatically overwhelming, like you're re-experiencing the event, you don't think you're going to be able to handle it at the moment, you might want to step back from that just a little. But what they found is that this common feelings that have come up during this process of when people do that, they report sadness, they report loss, they report grief, worry, fear, anxiety about the future, what's going to happen. So there's sort of flip sides of a similar coin. Depression tends to be a little bit about sadness of loss that has happened and feelings of a lack of vitality. And feelings of shut down. Anxiety is a little bit more about concern about what's going to threats that are going to happen in the future. So it's a little bit more geared up. It's kind of ramped up to fight or to take action. Uncertainty comes up. Where am I going? What's going to happen to me? Anger, right? Frustration, anger, upset, and a general sense of unfairness. Somebody said. You said it was like somebody else wrecked the car and I'm left to fix it, right? So some of those, which is a very powerful sort of feeling and metaphor to allow the space to have. So some long-term effects that they've seen in this kind of expressive writing paradigm include a general improved mood, emotions, and improved sense of well-being. They have actually found that even longitudinally, even a 4-day, 20-minute writing intervention over time has resulted in fewer days in the hospital for medical patients and less frequent medical visits over time. Not that this is a cure-all, but a lot of times people go into their doctors or even to the hospital in really acute emotional distress. They find that it reduces blood pressure and improved immune functioning. Right? We know that these are effects of your HPA system and trying to regulate the emotional effects of that. So a lot of times, I think people make the mistake of saying, well, I'm angry, I'm irritable, I'm sad, I'm going to shut it down, I'm going to think positive, I'm going to be calm. And speaking of performance situations, actually there was a recent study that came out where they looked at people in performance anxiety situations, and I love how they test this. They ask you to write a 5-minute speech and prepare some 5-minute speech on some topic that you know about, and you go and present to a panel of experts. And this panel of experts are an impressive-looking set of 3 people in medical laboratory white coats. And they sit down at a panel like this, and you present your speech to them, and they look at you. And the panel of experts are Confederates in the study, and they're told not to demonstrate any facial. So you're giving your 5-minute talk and the speech that you've prepared, and there's these experts. They look at you. And what happens is they measure the cortisol reactions. They measure the stress that people get. Not surprisingly, that's a very stressful experience. Infant researchers have done this with babies. That if you really want to stress a baby out, you have a baby interacting with their mother or their caregiver or their parent, and have the parent do what they call the still face paradigm. That the parent is instructed not to make a reaction, to just sit there still. It's terrible. It really stresses out the child, which tells you a bit about our social and emotional environment. We turn to other people in distress, and we want their positive responses. I think too often we tell people who are hurting or in pain or who are stressed or who are worried, who are anxious, to be calm, to relax, to shut it down, to get small. But we find that increases stress. I totally went off on a tangent, but where I was going with this was about when it comes to performance, that performance before that stress test, you can give people two instructions. One group of people was told to tell yourself in your head, I am calm, right? So you go in, I'm going to do this thing and say, I am calm. I am calm. Did anyone remember the Seinfeld episode, Serenity Now? Serenity Now. What happened at the end of that? Where did they go? They were freaking out. Those people did not do, so those kind of positive, soothing, I am calm affirmations, if it denies what your actual experience is, then they don't tend to work as well. They tend to backfire. They told the other group of people something else very interesting. They told a neutral group, too, and saw what the baseline was. But they told the other group of people to tell themselves, I am excited, which is different than I am calm, right? How do you feel when you're excited? You feel amped up. You feel ready for action. You feel ready to go. It's very similar to that feeling of anxiety. It's a little bit shading the truth, right? It's sort of like selling, putting the sales pitch on it, but it's not denying the emotion. It's not saying that emotion is not there, that I don't feel it. It's, yes, you feel that, but it's having a little bit of a different label for it. So if anyone tells you to ignore it, to feel positive, to feel good, tell them they're full of beans and get out of there. But there are ways in which with your emotions you can think and sort of shade those experiences that are, what am I feeling and can it be helpful to me right now? Can this motivate me towards action? Even if that action is feeling sad and feeling low, can that motivate you towards maybe taking a rest but not shutting down or shutting out? Or if you're feeling anxious, can it prepare you for some kind of action? Okay, so there's a difference there between sort of shading and using that emotion in a positive way and reacting to it and using it as a positive strength versus trying to deny it, shut it out, or even let it overwhelm you to the point where you just can't function. Second process through this is about holding yourself kindly, what researchers call self-compassion. The attributes of self-compassion include care for well-being, care for the well-being of yourself, care for the well-being of others around you, a sensitivity, and we were talking about this during the break, a sensitivity to your own experiences as well as the other people around you, a sort of intuitiveness of trying to connect to others, to trying to get a sense of how they feel, which goes to yourself as well. Can I connect with myself? What am I feeling? What am I experiencing? Sympathy for other people and yourself. Can you understand that experience? Can you hear it? Can you validate it? Can someone feel felt and understood? Along with self-compassion comes distress tolerance, right? During those times of emotional upset and overwhelm, and we know that Cushing's is a biological condition that increases that sense of agitation, feeling overwhelmed, feeling powerful emotional experiences. Having self-compassion can help you tolerate some of that distress. It does not make the physiological parts go away. None of this is going to eliminate these things, but it can help you manage them and what to do with them, and to feel sort of more connected with yourself. To have empathy for yourself and for others. and also to have openness to new experiences, to trying something new. Can you open up to emotions like we talked about earlier? Can you allow it be too expansive versus shutting down? There is a sort of brand of meditation or psychotherapy that is called compassion-focused treatment, or compassion-focused cognitive, or compassion-focused meditation. One thing that they do in that is they work with images, right? And our brains are image-making, storytelling machines, right? We generate images and thoughts and ideas and put them into coherent stories. Even if you're in a setting that makes no sense, or something you see something that actually has no explanation, people will make up a story to make it make sense. For example, there's something where you put people into a room with two ropes and a bucket, and somehow the two ropes are supposed to tie together, but they don't. And people are told that they're supposed to connect the two ropes, but they can't. They're too far away, and they can't quite get it together. But there's a bucket in the room. And what the researchers will do, they'll go and they'll say, after you've tried to figure this out, and they might do something on accident, like hit the rope so it swings. Then all of a sudden, people get an idea. They say, oh, I see the bucket. They tie the bucket to the rope, and they use the bucket to swing and then tie it to the rope. They have no idea why they did that. None of them ever say that I didn't have an idea and the researcher hit the rope so I thought of swinging. Everyone says, no, it just came to me. I have no idea what's going on. Everyone makes up some story about why. So we think in images, we think in stories in the absence of other stimuli. And one thing that compassion-focused therapy does is they talk about who is your perfect nurturer, right? If our images in our brain can create images that can create physical experiences. I want everybody to think about a nice, juicy hamburger. Think about that big whole wheat bun with lots of ketchup dripping off, and think about what it looks like on a fast food commercial, and you can get that sense, and right? You can feel kind of hungry for it. Your salivary glands will start increasing. Just by putting in those images, and getting in touch with them and having them be evocative, you can create physical sensations. The pornography industry is built on this. You can use this to benefit too, where they create what they call an image of their perfect nurturer. And one of these days I'll print this out and stop reading it off my phone, but I'm going to read it off my phone anyway, if I can pull it up. So here is an example of someone named Sylvie and her description of her perfect nurturer. And the point of this is to develop a compassionate image that during times of distress you can think about and get in touch with. Sylvie describes, my perfect nurturer rises still and tranquil high from the ground, her arms open in anticipation of an embrace. Her garments are loose and linen, so you see the visual images. Her overall texture is warm, breathable, sandstony skin, matte, warm, soft, alive. Her face is relaxed, her eyes closed in the moment of tasting that impending hug. Her smile is slight, calm, and otherworldly, spiritual, and content. Her embrace comes at times when I feel like a failure. She strengthens me. Her embrace comes at times of comfort and disappointment when she tells me how special I am, how much she loves me and what she thinks might be right for me. She tells me to listen to me. She trusts me and my opinion counts with her and that I am worthy. She whispers in a warm, soothing voice, hey, it's okay. Everything is going to be fine. But she's not a person. She is a moment of affection and acceptance. She marvels at me as I marvel at my child. Life isn't always going to be good and fun, but always she'll be waiting for me with her arms open, encouraging, soothing, trusting, holding me, just holding me. Okay, and so that's someone's description of their perfect nurturer that they turn to mentally in times of stress. This happens with us in a natural process when we're young and grow up. We have the image in an ideal environment. We have that sort of nurturing, soothing experience with caregivers and responsive others to us. And what happens is then we internalize those soothing images and those soothing experiences, so that when we're in other times of distress in our lives, we can regulate some of that distress. In periods of trauma and disrupted child development, that those images aren't there. Other people are scary, frightening. So the images that you get are ones that are worrisome and stress-provoking. But in a natural, sort of soothing, caregiving environment, connecting with that image and making this explicit and really connecting to it. Now, I read that, and many of you might feel like that's kind of what a friend of mine calls woo-woo. A little bit of that sort of woo-woo stuff. It doesn't have to, if you like the woo-woo, good for you. I'm not a huge woo-woo person myself, but it doesn't have to be woo-woo. It can be very much you. I've had people describe, I've had men, I hate to sort of genderize this, but men in the office might have a little bit harder with this, but they've come up with like football coaches, right? They've had their experience of somebody who was, this compassionate, caring, they were tough, they encouraged me when I was stressed, they were a person I could turn to, and they sort of got me motivated to go. So in your process, what is that image for you? Who is that nurturer? Who is that motivator? And can you connect with it during times of stress? Another thing to do when storms sweep you out of the way is to drop anchor and be present. Experiential avoidance is a term. It's a core mechanism in the development and maintenance of psychological distress and disruption of pleasant, engaging, and spontaneous activity. Experiential avoidance is one of the key elements across ranges of psychopathology. When we feel bad, we want to avoid experiences of feeling bad. If you're dealing with your kitchen stove, this is fine. This is smart. It says, I get hurt when I touch that kitchen stove. I'm not going to touch it when it's on anymore, right? That's a pretty smart, adaptable thing to do. When it's your life, when it's work stresses me out and I feel pain and frustration of going to work, or I don't like to have conversations with others when it might be uncomfortable, we tend to want to avoid those experiences. But all of a sudden, now we start shutting down elements of our life, right? This is where if you look at things like driving phobia, people really get in trouble. It's not the anxiety that they experience while driving that's the problem. All of a sudden, they stop putting themselves in those situations. They stop driving on the highway. They stop going down the street to work. Now they can't drive anywhere, and their life has really sort of got circumscribed to a very small area, and they can't get anywhere. So it's the experiential avoidance of things like negative emotions and difficulties and stress. We all feel those times of struggle. It's what people tend to do to avoid them that get them in trouble. So what have you tried to get rid of, avoid, suppress, escape, or distract yourself from negative or painful thoughts or feelings? And the DOTS acronym for this. Have you used distraction? Have you tried to opt out? Say, check that, that's it, I'm not doing it. I'm not doing this anymore, I'm out. I'm done. Have you tried to use thinking strategies like telling yourself, no, this isn't a problem, I'm positive, it's all good? And how well does that work and how long does it work? Then there's also substances, self-endangering, turning to drugs, alcohol, excessive eating, all of those things. Are those things that you've done to try and avoid or not face negative emotions? One of the things that really comes into play in alcohol and substance abuse particularly is a lot of people with anxiety problems. They don't start out as addicts and say, hey, I was looking to go get a good time and then all of a sudden I became an addict. They actually had a lot of experience of anxiousness, worry in their life. A lot of anxiety disorders then go into substances. Well, if I drink, I don't feel as anxious at a party. And so then I just kept drinking. And then I started drinking at home because I felt anxious about going to the day at work. And that's where people get into trouble. It's the experiential avoidance strategies. And there's one thing in this talk that I haven't brought up, mainly because you've probably been told by your doctors over and over again. I know I have, and I still don't do it. But one of the biggest sources of experiential avoidance is physical movement, right? How many of us say, well, I'm too tired, or I don't want to go and be active, I don't want to move? And how does that start to pile up? Now, doctors often prescribe, just go work out, like it's easy like that. But notice, what are the things about being physically active that you're avoiding? Is it because you feel tired and you don't want to take space for yourself? Is it embarrassment about working out around other people or worry about sweating? Those things may be anxiety provoking, but if it causes you to avoid things like being physically active, physical movement, really being engaged, then they're going to cause trouble over time. All right. Dropping anchor and being present also includes what we call mindfulness or mindfulness meditation. Mindfulness is a state of active, open attention on the present moment. When you're mindful, you observe your thoughts and feelings from a distance without judging them to be good or bad. Instead of letting your life pass you by, mindfulness means living in the moment and awakening to experience. Mindfulness meditation is something that's done when people's thoughts are racing. It's hard to, you might say, well, I find it hard to concentrate. And so how could I possibly be mindful and sit and meditate when I have concentration problems? In fact, that's actually the very thing that it's targeted to help, is we know that the concentration problems and memory are part of this condition. But there are things that you can do to take that head on and to be active in managing it. Mindfulness meditation is one of those. You can do mindfulness meditation in formal classes and formal exercises and activities, or you can do it informally. Mindfulness skills involve describing your experience, observing it, and being open to your experience non-judgmentally. You can do mindfulness exercises with a raisin. I've literally seen people take 15 minutes, no, 30 minutes, to eat a raisin, right? You can slow down and really be present in that experience with that raisin. You can describe what it looks like. You can describe what you see on the textures. You can describe the feeling of it. You can, I don't know how much a raisin smells, but you can see how it looks, right? So you can slow down that experience and be really present in that present moment and savor it. And people have found that this greatly reduces a lot of stress, a lot of anxiety, a lot of those kind of ramped up feelings by bringing people into the present moment awareness. So what you find, like with the social stress test, where you present to the doctors in the white coats, people who've been through mindfulness meditation practices, or they've practiced mindfulness meditation, their cortisol responses actually are lower than people who have not. Practice mindful self-care, eat healthily, get adequate sleep, exercise your body, movement, get out into nature, breathe fresh air, take in the beauty of the natural world with your senses. Try cultivating a mindful, gentle yoga practice. You talked about how good yoga is. I personally find I'm the kind of guy who during physical movement needs to think about nothing else. I feel like I think about stuff all day long, and I just want to be in a place. And people are like, don't you get bored on a treadmill? I'm like, no. I want to listen to my Taylor Swift and stare at the wall and not have to answer emails. So whatever sort of physical movement that you can find is meditative and gentle and restorative and fits you. For my wife, it's like lifting weights, which I don't get whatsoever. But whatever it is that's for you, that works. Schedule time for being instead of always doing. And this is where the point of the talk, where I wish I could practice what I preach. But the reason we do is we study those things that are hard for us. Another thing, when storms sweep you by, gather your crew. I think it's come up here a number of times. Other people matter, right? You cannot do this alone. A lot of people think that they can take on this stuff on their own. You can't. None of us are on our own. We're an interconnected being. We rely on the presence and availability of other people in our lives, or we literally die of isolation. You can meet all the physical needs, but if you remove somebody from social stimulation, they will literally die. Loneliness is, they're starting, I saw Sanjay Gupta and Oprah campaign is called Just Say Hello. They're starting to do this now. They've looked at loneliness as a health risk factor. It is a bigger risk factor than obesity, depression, although it's related, diabetes. Loneliness and social isolation is actually a bigger factor for mortality than all of those. Other people matter, and there are 3 important C's in other people. It's connecting, it's caring, and contribution. You can have all the connection in the world, like you can be in New York City around a whole bunch of other people, but if you don't have that caring connection or that feeling of someone is warm and connected, then it's not going to work. It's got to be a component of all of these, and it's got to be contribution. What do you get from other people? What do you give to other people? You may not be able to return to work right away. And this is one of the biggest things that I find people struggle. I can't return to work, so I'm at home and I don't really do anything because of my condition. I can't return to work. Have you considered volunteering? No, no one does. Volunteering, they don't expect you to be there from 8 to 5. Well, maybe some places might, but they don't expect you to be there from 8 to 5. They don't expect you to be on the top of your game. You can contribute whatever you can do. And people say, well, I'm 55 and I lost my job because of my kidney condition, went through this transplant, and I'm not back to work yet, and might not be able to, and might never get back to. Have you considered volunteering? No. What would it be like to do that? You can contribute, be active. Anything that you can give, and your presence with other people will help and will matter. Something that came up, and I don't have a slide for this, but something that came up during the break is in terms of attending to mental health needs, and I'm sorry for that. In terms of attending to mental health needs through this process, who do you find? As you know, going from doctor to doctor, people who don't really have experience or expertise in this area can be really difficult. How do you get mental health support? I think if you're going to a psychiatrist, and I can say this because there are no psychiatrists in the room, right? I usually am not in such a great position to say this, but if you, it was like Dr. Vance said earlier, that if you go to a Midas, they'll fix your muffler, right? If you go to a psychiatrist, you'll get medications. I think it's important if you're going to a psychiatrist to get psychiatric care that there's somebody who works closely with your surgical and endocrine team, that they have a close collaborative relationship, that they know what they're doing, that they have experience in endocrine conditions, because the medications, you don't want a doctor just throwing an antidepressant at you and sending you out the door. You want a psychiatrist who's working with you medically to be a member of your medical team and collaborating. I know that's really tough to find in this area. When it comes to a therapist and therapy, you get a little bit of a broader sense. I don't think you necessarily have to find a therapist who specializes in Cushing's. I don't know if there are any even out there, right? But with therapy, you can find people who specialize in chronic illness, chronic medical conditions, complex medical, that there are therapists out there who do that. Even some therapists might get that wide-eyed sort of sense of like, oh, I've not seen anything like this, right? There's a particular brand, I'm not one for much brands of therapy, but there is a particular brand of therapy that I practice from called Interpersonal Therapy, IPT. It's something that's an evidence-based therapy developed specifically for depression, but has been applied in a number of conditions. Been applied for people after diagnosis of HIV status, for diabetes, and it takes the tack that depression and anxiety are medically based conditions. It is not your fault that you are not crazy. It is not your fault. It is not some defect in your personality that leads to how you're feeling. That medically something is going on to contribute to that. It's a biopsychosocial. But we know that your health always occurs in an interpersonal context. It always is affected by and also has effects on your interpersonal relationships. So interpersonal situations that can contribute to or be exacerbated by depression and medical conditions. through interpersonal experiences, and they classify a couple of different type of interpersonal experiences. One of them is grief or complicated grief reactions, where somebody has died recently or in the past that you have to go through the grieving process of what it's like to lose that person, get in touch with the emotions, and increase your social support with that. There is also interpersonal role transitions, and chronic illness is seen as one of those. Is a role transition from where you were, which was a healthy place before, to now you're dealing with illness, you're trying to work with your doctors, you're trying to deal with your family members who might not understand. How do you deal with people at work if you go back to work? And interpersonal therapy takes the tack that, that is not your fault. There's no defect in you're not crazy, but helping your relationships, getting better functional social support can help you through that process. And how do you talk to people? Looking at your communication patterns with others to say, are you getting the kind of support from others that you would like? Are there ways in which you can change your own communication style to get that from other people? What kind of education and support can you get for that? Can you relate your mood symptoms to what's happening in your interpersonal life? Like the question about work. If things are not going well at work, certainly Cushing's has an effect on how your work performance is going to be. That's not your fault. But you do have to manage it, and you have to respond to it. And how do you navigate those interpersonal relationships at work when someone might not understand, or you're having physical difficulties, or you're fatigued? How do you kind of navigate that interpersonal environment? And interpersonal psychotherapy is something that particularly targets that.
Is that what you would ask for?
Yeah, you could. Yeah. So the various different things I've talked about today, you can ask for a mindfulness-based psychotherapy, which is the sort of the mindfulness, meditative. You can ask for compassion-based cognitive. You can ask for interpersonal therapy or IPT. And there aren't a ton of experts out there in the country who practice it, but there are a lot of folks who do, and it's a growing field. Most of what you'll find out there are people who might describe themselves as CBT researchers or CBT clinicians. And that kind of takes the tack that your thoughts affect how you feel and your behaviors. With that, and they'll help you track your thoughts over time. They'll help you try and be more behaviorally active and get back into your life. With that, you want to make sure with any of these therapists that they're somebody who, even if they don't understand Cushing's in particular, like me, I don't have a lot of experience and knowledge with, but they are somebody who you feel can understand, who, if they don't have a knowledge of what your medical condition is, that they will get information about it, and that they will help you feel, not that you're being pushed off or told that you're crazy or that this is happening and is making you depressed and this is a problem or a defect in you, but is something that you can and have a responsibility to have active adjustments to, and that it is an important part to help you work with your medical team, and that you can feel comfortable with, and that what's going on is not your fault, but there are things that you can do to improve it, even if you don't necessarily make it go away. So working with a therapist who understands that. Also, support groups, way underutilized. Right? It's things like today, places where you can come into a community and get information and talk with others and talk with other family members of and get social support. Other people matter. It's such in every kind of medical illness, social support is one of those variables that really affects how people manage their condition and how they feel about it. One exercise that Martin Seligman's a researcher who studies positive psychology about how do we help people connect and feel better about stuff. So this was a research-based protocol, and he did something called the gratitude visit and found that expressing gratitude to others can make you feel better and more connected. So this might be something you might want to think about giving a try. His instructions are this: select one important person from your past who's made a major positive difference in your life and whom you never fully expressed your thanks. Do not confound the selection with newfound romantic love or with the possibility of a future gain, right? This isn't about going to your boss and saying, thank you, boss, you're so wonderful, can you give me a raise? Or it's not it should be somebody who you feel has genuinely helped you out and you haven't totally expressed maybe thanks for them. Write a testimonial just long enough to cover one page. Take your time composing this. My students and I found ourselves taking several weeks. Invite that person to your home or travel to that person's home. It is important that you do this face-to-face, not just in writing or on the phone. Although, hey, who says you only have to do it once? Do not tell the person the purpose of the visit in advance. A simple, I just want to see you will suffice. Although if somebody said that to me, it would make me really, really anxious. It's sort of like I'm getting in trouble for something, but that's my own thing. Wine and cheese do not matter, but bring a laminated version of your testimonial with you as a gift. When all settles down, read your testimonial aloud slowly, with expression and with eye contact. You might totally freak the other person out about what's happening. They might think they're like on A&E intervention. But then let the other person react unhurriedly. Reminisce together about the concrete events that make this person so important to you. And they found that by giving people instructions to do this, it had lasting effects on their depression and well-being. Just one gratitude visit. Now, who says you have to do it once? Can you cultivate this in a regular way throughout your life? Another thing he says to kind of cultivate this is at the end of each day, think about what are 3 things that happened today that I am thankful for or grateful for. All right, and finally, and I'll wrap this up real quick, grab your compass and figure out that success is living by our values. Success is not about accomplishments or checking things off the box, although I think we often get caught in that drive mode of saying, I've done this, I've achieved this. There is a difference between values and goals. Goals are things you can put a checklist and check off when you're done. Losing 10 pounds is a goal. Buying a new car is a goal. Getting married is a goal. Values are ongoing qualities of desired action. It's something that is never done. Getting married is a goal, but being a good husband and father is a value. You never are done doing that. Taking your medication today or taking your medication 3 times a day is a goal. Taking care of your health responsibly and doing all the things that you need to do to take care of your health and well-being are values. You can take steps towards those values, and they are never done. So look at your sort of life compass and find out what are your values with your family relationships, with your physical well-being, with your community, with education or personal growth, with parenting, with marriage and couple relations. What kind of husband, wife, partner do you want to be? What quality of relationship do you want to be a part of? What kind of values do you have regarding your physical well-being? How do you want to look after yourself? We can get caught up in goal-oriented thinking, and it doesn't last very long. But if you're ongoing reminded and even write down and record what your values are in each of these different domains, and are you living up to your values? Have the things and actions you've done today, have they brought you closer to these values, or are they a step farther away? So taking an inventory of what you value in your health, in your relationships, in your own personal or spiritual growth matters, and then taking the steps in the direction of moving that so that once you've been blown off course, you can start moving in a direction again that you feel good about. So when life storms hit, remember to open up, move towards your emotions, hold yourself kindly, drop anchor and be present. Gather your crew and other people matter, and grab your compass and know what matters to you and your values. That's it. Thank you.